Another question that I get a lot, and I want to clear up the confusion around, is something called spinal stenosis. So spinal stenosis simply means a narrowing down of the opening where your spinal cord comes through. Let me do it that way, right? So if that canal gets narrowed, we call that stenosis. But you have to understand the borders around the spinal canal so you can understand what's causing the stenosis. Because when I ask patients, well, you've been diagnosed with stenosis from your previous doctor, what's causing it? They look at me like, I have no idea, the stenosis is causing the stenosis. And that's not the case. A herniated disc can cause stenosis, a bulging disc can cause stenosis, facet arthropathy or facet hypertrophy can cause stenosis. A slippage of one vertebra forward called a spondylolisthesis or backward or retrolisthesis can cause spinal stenosis. You can have something called an epidural lipoma sitting inside the canal that can cause it. So you can see you can have bone spurs that are causing it, and you can typically, and this is almost what I almost always see, is that there's a combination of things that are causing the stenosis. But once you know what those things are that are causing the stenosis, you can typically come up, or we can typically come up with a therapeutic plan to get you out of pain and help reduce the stenosis that's giving you, whether it's giving you pain in your back or just simply weakness in your legs. Most of the people that we see don't have a lot of back pain, but they have tremendous weakness in their leg or pain in their legs that causes them to have to, like when they go shopping, to like hunch over the shopping cart as they're walking through the market because they just can't take the pressure. So that's a hallmark of spinal stenosis. It does not necessarily mean rather that you need to have surgery. What needs to happen is it needs to be evaluated neurologically, and you need to be evaluated by an MRI. We need to correlate those findings to see what's really causing it and what's going to be the best non-invasive means to help you with your spinal stenosis. Anyway, I hope that helps and clears something up around the term spinal stenosis. Thanks.